What's up? Doc Mike. Public Health on Call. By Johns Hopkins Bloomberg School of Public Health. Today's topic for March 18, 2021. 1 year in COVID-19 Q&A with Dr. Josh Sharfstein. Thank you, Johns Hopkins Bloomberg School of Public Health.
Good morning and welcome to another live edition of Public Health on Call. I'm your host, Stephanie Desmond. Today, I am talking to my favorite public health expert, my co-host, Dr. Josh Sharfstein, a former Maryland Health Commissioner, high-ranking FDA official, and a Vice Dean at Johns Hopkins. Thanks so much for joining me.
Good to see you, Stephanie.
So today we are answering questions from those who posted in the comments this week, and also questions from those who sent their questions to publichealthquestion@jhu.edu. And Josh, we received a lot of questions about vaccines this week.
Well, it's been a great week, a lot of great episodes through Facebook Live this week.
It's been a lot of fun. So here we have our first question. Most COVID vaccine information is focused on how effective they are at preventing serious disease, hospitalization, and death. How is it possible that the vaccine is more effective at preventing serious illness and death than it is preventing a mild infection?
That's a good question, and it's actually very common for vaccines to be much better at preventing serious illness and death than preventing infection or mild infection. For example, the flu vaccine, people can still often get the flu, but they are much less likely to get seriously ill or die if they get the flu vaccine. It's also true with other infections. And so now the question is why? I don't know if I give the full answer to that, but it partly depends on, it relates to how the immune system responds to vaccines and what it takes to completely block any infection whatsoever is a certain type of immune response. And very few vaccines give that full, some people call it sterilizing immune response. But what vaccines do cause is an immune response that is strong and multifaceted inside your body. So even if the virus can replicate a bit for a mild infection, it can't really penetrate to cause that huge, overwhelming infection that really puts people at risk. And so actually, early on in the pandemic, before we even had vaccines, I was talking to some vaccine experts, and they were saying the most important thing is going to be serious illness and death, and it probably will be much better for that than for mild illness, just like almost every other vaccine out there. And sure enough, that proved to be the case.
Mm-hmm. That's very, very interesting. So how effective are vaccines at preventing long haul COVID then?
So that's a question we don't know. It's a good question because people can get these long-term symptoms from relatively mild infections. So a natural question might be, well, maybe the vaccine can't prevent me from getting a mild infection, but what if I get a mild infection and go on to get these long-term symptoms? There are some studies being set up to assess this. We don't know for sure. I think the safe bet would be that the chance of getting a long-haul infection is going to be much lower among someone who's vaccinated compared to someone who's not vaccinated, just because it's much less likely you get infected at all. Mm-hmm. And there is a reduction even in those mild infections. Is just not as great as the reduction in serious infections. So getting vaccinated definitely makes sense. There's also this related question of whether people with long-term symptoms from COVID actually might benefit from getting vaccinated. So somebody who had an infection has just been suffering some of those symptoms, fatigue, and others, that brain fog people talk about. Does it get better if you get vaccinated? And there's no answer to that. However, there are some people who are reporting feeling better. And at multiple clinical sites, some of the doctors are hearing from their patients that they're feeling somewhat better. And I think that the real answer to that, though, is going to depend on studies that will be completed to see whether it makes a difference.
Mm-hmm. Some of the people I've spoken to who are long haulers who have gotten the vaccine, however, have felt very sick when they got the vaccine, and it set them back a bit at the time.
Well, that's why it's important to have good research. So yeah. Some people might say I felt better, some people might say I felt worse, and it's sometimes hard to know from talking to any individual or couple people. You really got to look over a larger group to see how they felt.
Absolutely. Here's another question. I just received my second dose of the Pfizer COVID vaccine and had no symptoms at all. Does this indicate that if I had gotten COVID, I would have been asymptomatic or had mild symptoms?
I do not think it means that, no. What determines how sick you are is a complex set of things that include how much virus your body actually took in. And so that's one reason. People who get exposed to lower levels of virus are more likely to have a infection without symptoms, for example. And then it also relates to different aspects of people's immune system, and probably some other factors we haven't figured out. So I would not assume that at all. The response to the vaccine is not necessarily the same as the response to the actual virus.
And here we have this question. Is this the first time mRNA technology has been used in a vaccine?
It is not, actually. There are several vaccines that are in development with mRNA technology, and actually they've completed safety studies for them. That includes influenza, so there could be an mRNA flu vaccine in the future, cytomegalovirus, the Zika virus, and the rabies virus. So there are multiple vaccines against those different viruses through mRNA technology. Now, they haven't made it all the way to the end, and so some people wonder, well, how come they haven't made it all the way to the end? And the answer is that those were going through the regular vaccine process where you go one step at a time, and the companies aren't going to invest in a big next trial until they've really analyzed the data from the previous study. And so in this case, for coronavirus, we had a lot of urgency, and so all the money was put up front. The companies didn't have to find the money for each stage. They were just able to just proceed from the safety study to the effectiveness study very quickly. And so this led the coronavirus vaccines to go to the front of the line because of the urgency. But actually, this is a technology that's been well studied, not just for vaccines, but also for therapeutics.
And this is my question. So do you think that having this successful RNA COVID vaccine will pave the way for these other vaccines?
I think it's going to be great for people's comfort level with the vaccine, both at a just understanding level, like, wow, that's going to be like the coronavirus vaccine that was so successful, but also scientifically, I think there'll be a greater understanding of mRNA vaccines, and that will help with the development and the review of other mRNA vaccines for different viruses. Now, having said that, just because an mRNA vaccine works for coronavirus doesn't mean it's necessarily going to work for rabies or influenza or cytomegalovirus. They're going to have to do studies to find out.
It's all encouraging though for the future.
It is encouraging. And this is a platform that has certain advantages, among them that you can stand it up so quickly. It doesn't require a lot of different ingredients. It's very, very small number of things go into the vaccine, and it can be updated very quickly. So if you need to change the strain, it's very possible to do that quickly. So it's very promising, and I think we'll look back and think mRNA kind of had its coming out party with coronavirus, but it's been around beforehand, and it will hopefully lead to some other important advances in medicine.
So another listener question: how are side effects from vaccines being monitored?
So they're being monitored in multiple ways. One thing that people who've gotten vaccinated know is that you have an opportunity to get texted about the potential side effects that you're experiencing, and the Centers for Disease Control is looking at that from millions of people who are getting vaccinated to understand the profile of side effects. Also, people submit reports to the manufacturers and to FDA about potential side effects, and also there are studies that are done in large insurance databases or clinical databases where you can look at the people who got the vaccine compared to people who didn't get the vaccine to see whether there's any difference in case there's a question about whether or not a particular side effect might be caused by the vaccine. And on a regular basis, there is a big group that comes together and looks at data from all these different sources to see what the safety profile is. And so far, it's been very, very strong. I was just looking at a 60-page document that's posted on the CDC website from last week, I believe, where they went through all these different sources, and they have a huge analysis of allergic reactions. I think that for the Pfizer vaccine, 5 serious allergic reactions per million doses given, 2.8 per million for the Moderna vaccine. And they kind of explain all about the risks. Almost always those allergic reactions are in the first dose. Not always, but almost always. That was something I learned by looking at this report. It also talks about, the evidence of the mild side effects people get. 70% of the people get a sore arm. In one of these reports, I think about a third got a headache, a third got fatigue, but then of course they feel better in just a couple days. And then they've been even doing studies in these insurance databases to compare people who are vaccinated and people who aren't vaccinated for just things, that people think, well, maybe could it possibly relate to this? And they have not found any serious red flags coming up. So there's a lot of analysis of safety data, and there will continue to be. It's a very important part of vaccination and the vaccination program to look at safety, and not just in one way, but in multiple ways.
Mm-hmm. It's the safety of this and the effectiveness is just remarkable to me as a layperson. We have another question. Does someone who recovered from COVID and then gets vaccinated, do they have a higher immunity than someone who hasn't had COVID itself?
And also gets vaccinated, you mean? In general, people who have had COVID have some immune reaction to COVID when they recover, but it's variable. So some people may have a pretty mild immune reaction. Some people may have a very protective immune reaction. Right now, we don't have an easy way to tell the difference between them. And that's why vaccination is recommended for everyone, even if you've had COVID before. Mm-hmm. There will be studies of different types of people and their vaccination status and when they got vaccinated. And hopefully what we'll get is a picture and some markers, like a blood test that you could take to find out how protected you are. We have that for certain infectious diseases. You can, for example, for hepatitis B, you can see whether you have antibodies to the vaccine that would protect you against the viral infection. And one of the things we'll learn from some of these studies is there a way to test people for their ability to withstand a coronavirus infection? And when we have that, I think that might be more important than these general questions, because probably it will depend on the individual, and having some way to test to figure that out over time will be helpful to people.
Mm-hmm. I know, for example, I've been tested several times to see if I have MMR titers, measles, mumps, rubella, to see if those vaccines have worked for me. And every time they test me, they find that I don't have the titers, and they give me another shot. So I think that's been...
Yeah, and actually those titers aren't perfect, because sometimes people won't have titers, but they will be protected. But in the absence of a better test, you may get stuck a little bit more.
Yeah. So here's another one. If I've had COVID, how long should I wait to get vaccinated? Is it okay to get my first dose if I no longer have symptoms?
Yeah, so these basic standard requirements are that if you are in that period where you're sick and could be spreading COVID, to stay home until you get better. And so there's the basic requirements for isolation. Once you're out of that window, which I think is around 10 days and no symptoms, then it's fine to get vaccinated. Different people have said you don't absolutely, you're probably relatively protected from another infection for a couple months after that infection. And if you want to wait a couple months to get vaccinated, you can do that, but there's no requirement to do that. It's perfectly fine to get vaccinated. And in fact, there are people who may get COVID right after their first shot, before there's any protection, and they could get vaccinated too. For their second shot on time if they want, with one exception. If they've been treated for that COVID infection with antibody treatment, then there's a recommendation to wait 90 days so that that antibody treatment doesn't interfere with the vaccination.
Mhm, mhm. So this one actually jumps back to the conversation we had about mRNA vaccines. So do we know yet how soon flu vaccines may be made as mRNA vaccines? And will they have to go through clinical trials as a new vaccine?
I would expect they would go through clinical trials just because you don't necessarily know how the body's going to react to a different type of vaccine altogether.
Mhm.
But I do know that some studies have already been done, like I said before, and hopefully this will proceed and we'll get another great vaccine. You know, one of the long-held goals for flu vaccination is a vaccine that lasts more than 1 year, and so you don't have to keep getting it, and maybe a vaccine that um, doesn't require a strain change every year. So the mRNA vaccines, maybe there'll be a way to get to that goal, but there obviously has to be a lot more research.
Mhm. So what will happen if everyone gets vaccinated? Won't the variants get tougher as their source of food gets eliminated?
So that's not how you should think about variants. The virus is constantly mutating, and every time that it replicates, there's a chance that you could, develop a variant. And so if the virus can't replicate, the virus can't develop a variant. If the virus is replicating a lot, then you're more likely to get variants. And so the goal of a vaccination campaign now is to reduce the spread of the virus. That reduces the replication of the virus. That will reduce the chance there'll be more variants.
Mhm.
If we were to say, like, well, let's not vaccinate ourselves and hope that the variants don't come, you actually are more likely to get variants in that situation because the virus is just spreading so much.
Mhm.
So if the less virus, first of all, fewer people dying, so that's good. The less virus, fewer variants.
And so here I have one last question here. What do we know about the CDC's plan to release guidance for what vaccinated people can and can't do safely? Any thoughts on what you think that will say?
I don't know what the CDC is going to do. I think people will be looking at that. One important principle, though, is that I think the vaccination is both important to people directly and indirectly. So directly, it's important. Like if you're protected, there may be some things that are different for you. Like, in small groups, you can meet up with other people who are vaccinated. That may be a recommendation that CDC makes. So that just because you're vaccinated, that there's a direct benefit. There's also the indirect benefit, which is the more people get vaccinated, the less coronavirus is spreading out there. The less coronavirus spreading out there, the easier it is to open things up again. And so that's the indirect benefit. So that may not happen the day you get vaccinated or the day, you're protected from your vaccine. But the more people in your community get vaccinated, the more likely that indirect benefit is going to come back and help you. So what I've been saying is, make a list of all the things you want to do. And some of those things on that list may be okay to do now. And the other ones, if you get vaccinated and other people get vaccinated, are in the not too distant future. I think this is exciting because we can see what the end of the pandemic would look like. We just have to get there. We can't trip on our way running too fast to the end of the pandemic.
I wanted to ask you actually, this is my question. We've heard this week that Texas and Mississippi have both rescinded their mask mandates. To me, that feels like getting a little bit too far ahead of ourselves. I'm curious what your thought is when it comes to those changes.
Well, we did a Public Health on Call episode this week with Dr. Lisa Maragakis, who runs the infection control program at Johns Hopkins Hospital. And, she talked about a football game where a football player was running towards the end zone and kind of celebrating and get the ball taken away from them right before the end zone. And she said, I don't want to see the United States with COVID. Her concern is that we are winning the battle right now, but we have to really win it. Push COVID as far into the box as we can go through, good mask wearing, social distancing, vaccination, until we really are able to open things with confidence. And the risk of doing it too soon is the virus keeps spreading. You get mutations, you get potential variants spreading, and we wind up, taking a step back that takes longer in the end to get to the place that we all want to go. Personally, I'm concerned about the mixed messaging. Mask wearing really does reduce infection. We still have a lot of infections in the United States, even though it has come down. And just to hear from like one level of government do this and another level of government do that, it just, stirs the pot again, makes it harder for people just to, stick with the program long enough to really put coronavirus back in a box, which I think is within reach. Now, will what the governors do really upend that? We don't know, but will it increase the risk of a problem? It might. And I think that's why you hear so many people like Dr. Maragakis saying, we're headed towards the end zone, don't blow it.
Yeah. Well, Josh Sharfstein, this has really been a pleasure. Thank you so much. Thank you so much for joining me.
Thanks, Stephanie.